Good afternoon and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician. I assist busy professionals to find solutions for their acute and chronic medical needs. We do this through our telemedicine program, concierge medicine program, primary care, COVID-19 testing, and COVID-19 vaccines. In addition to that, we do it through my brand new Amazon best-selling book, Vitality, and by partnering with CBS News to bring you house calls every Monday for a new segment where we try to keep you healthy. So good afternoon, ladies and gentlemen, and welcome to Let's Chat. So I thought this Sunday we talk about and highlight something that has been finding its way into the news more so. I haven't talked about, hey, pretty Barbie, thank you for tuning in. I haven't talked about COVID-19 in a while. I know that there's been a lot of information that's out there, a lot of what has gone on with COVID and what the benefit rather of the vaccines has been, in the news, and we've done it redundantly so in an attempt to help educate everyone about COVID-19 because it is something that we've been plagued with for over a year now. We've been in the pandemic and things change. So today, though, we're going to focus on three little things I'd like you to think about, and specifically for those of you that may not be vaccinated, specifically for those of you that may not be vaccinated. If you are vaccinated and you have family members that are not vaccinated and you want them to have some more information, please share this with them, and please make sure that you continue to watch and follow what's going on with this Delta strain of COVID-19. Now, this strain has been coined by not just the Centers for Disease Control here in the United States, not just here, but by global health experts and physicians around the world are very, very consistent in their message about this strain. It has been termed the fastest and the fittest coronavirus strain. And they say that it's going to pick off the vulnerable population. It's responsible now for over 20% of the new COVID-19 cases that we're seeing, and they predict that it will take the place of the Alpha strain, which had been previously from the UK that had been transmitted across the country. So why are we so concerned about the Delta strain? So the three things I want someone that's not vaccinated to consider or make sure that they keep in mind, because I'm a firm believer that prevention is very, very important. And the way that we help with prevention is to provide as much education as possible. So the reason why we're so concerned about this strain is because this particular strain has multiple mutations. And when we say mutations, every virus has its own genetic makeup that it has. So there are changes in those genes that can occur. We call those mutations over time, and as those viruses reproduce more of themselves. When COVID-19 infects your body, it goes in primarily through the nose, but we know it goes in through the eyes, the nose, the mouth. But as soon as it comes into your body, its objective is to get into one of your, what we call host cells, or one of your cells, and use your DNA to make copies of itself, right? So when it makes copies of itself, the virus itself can change or mutate, or that genetic makeup of that virus can mutate. The mutations that this particular strain of coronavirus have undergone have made it more contagious, more transmissible. And what that means is that it's just easier to get it, y'all. That's all that it means, guys. That's all that it means, is that it's just easier for you to get it. So it's more contagious. We know that it's passed by respiratory droplet. When we cough, we sneeze, blow our nose, all those things. We know about washing our hands. We know about being socially distant. And we know about the power and our secret weapon, which has become my best friend, which is my mask, which I do definitely still take out with me when I leave home each day. So the first thing to consider, those of you that are not vaccinated, and to be honest, I'm talking to people that are unvaccinated, but I'm still talking to the people that are vaccinated in this sense. We need to be mindful of what we see going on. We were in the same position a year ago with COVID-19, with restrictions, not being able to be socially, what we call socially normal. We've been doing that for a while. People that are vaccinated should still keep in their minds and just consider where you are and what you're doing, and just remember that there is a virus that is still circulating out there. So I would not, definitely not throw away my mask. I would be taking my mask with me when I leave my home. And depending upon the situation, I would be placing it on and wearing it. So the first thing is the multiple mutations. And so that's something that unvaccinated people definitely need to think about. Now, again, second consideration for people unvaccinated to think about. There have been multiple health experts, not just here in the US, multiple health experts around the world who have consistently found the same data and have the same concerns that this Delta variant will be the most dominant strain in the world and that will drive unrelenting outbreaks in the unvaccinated population. So what that means is there are a lot of physicians around the world that are concerned that this Delta variant, because it's more contagious, we just talked about that, it's more transmissible, right? That it's going to become the most dominant strain in the world, which we don't want because it is more contagious, but because it's going to drive outbreaks potentially in those people that are not vaccinated because they have no protection, they have no immunity, okay? Third consideration if you're not vaccinated. So if you're out there and you're like, you know what, Dr. Celeste, I've been listening to you. Hi, Ms. Jones. Thank you for joining. I've been hearing you and other physicians talk about this. We've heard it, you know, from a political aspect, unfortunately, because I don't think health concerns like this need to be politicized at all. Not good for everyone's health. And there's been a lot of talk about it. So you may say to yourself, well, you know, why are we still talking about this? Why is it a concern? Why do you all just seem to be obsessed with trying to make us take this vaccine? First of all, no one's going to make you take it. What we definitely are trying to do is share with you potential for the foreseeable and acute future, right? Because and you get a vaccine, and this is the third consideration, and this is why I'm talking about this now. This is what drove me to talk about this today in particular. It actually takes you at least 5 weeks. Once you make the decision that, hey, I'm going to get vaccinated, it takes 5 weeks for you to become fully immunized if you take Pfizer or if you take Moderna, which are the two most common vaccines that most patients, at least in my practice, have been asking for. And we have Pfizer in my practice. If you take the Johnson & Johnson vaccine, it's 2 to 3 weeks for that one. The reason that I share that with you, 3 weeks for that one, the reason that I share that with you is because you have to remember it when and if you make the decision, hey, I want to be protected, it takes that long to protect you. 5 weeks is a long period of time, right? Right. So I'm bringing it up now because of some of the things that we're seeing in terms of the way, the fact that this variant is in our community here in Birmingham, Alabama. The fact that there are a lot of people, because the mask restrictions have been uplifted, are going about the cabin as usual, as if COVID is not here. And my concern mainly is for those people that are not vaccinated, obviously, because they have no protection. So, and you may say, if I'm vaccinated, why should I be concerned about the Delta strain? All the vaccines that we have right now have shown evidence to have protection against this particular strain, correct? So we have some level of protection against this strain. The concern is the rapid spread of the variant that could cause this virus to still spread or transmit among the unvaccinated population. There are a large number of people, especially here in our state. Y'all, we are last in the country. We're one of the last 2 or 3 states in the country as far as the percentage of people that are vaccinated. That means if we only have 40% of the people in our state vaccinated, that means 60% of the people in our state are left with no protection against COVID-19 unless they had COVID-19 in the past, and then they will have natural immunity as a result of them having infection. We know that natural immunity lasts anywhere from a few weeks to 3 to 4 months is what most people have found post-COVID infection. So that immunity is also going to decline. They're seeing an increase in spread of this particular variant in areas where people are not vaccinated, right? And especially in areas where there are low vaccination rates. And guess what? Y'all, that's us. That's Alabama, right? So we need to think about this. I encourage anyone that's not vaccinated to consider becoming vaccinated. I've had several questions. I get questions all the time. Sometimes people will come by the office, and if you're out there and you have questions about the vaccine and you want to get a vaccine and you're not sure that you want to or what have you, if you want to have a conversation about that, I'm more than happy to see you and answer any questions. Our office number is 205-291-8842. While I cannot answer those questions by phone, if you come by our office and make an appointment, we will be more than happy to see you, talk to you about it. If you make a decision then that you want to be vaccinated, we'll vaccinate you. No problem with that. But we're more than happy to answer all questions related to any hesitancy about the vaccine or any questions that anyone has in particular. I do want to remind people that are part of the most vulnerable population. That includes the elderly, people with chronic medical conditions such as, but not limited to, coronary disease or heart disease, asthma, COPD, lung disease, kidney disease, high blood pressure, diabetes, people with autoimmune conditions. You all are a group of people that you have to be very vigilant about protecting your health. And it's that time that you should do that. I would be very concerned and very careful about what situation socially. I know that the 4th of July is coming up. And I know that everyone is tired of staying in and tired of being away from their family, but please make sure that you socialize with us thinking about what's going on right now, because the last thing we want is to have a large surge as a result of the holiday and mixing, vaccinated and unvaccinated persons. If you are not vaccinated, please make sure that you are religiously wearing a mask to protect the other people around you. If you are not, you are putting yourself at risk for COVID and those other individuals. So these are just things that we, have to think about. Let's see. Pretty Barbie has a question. She said, Dr. Celeste, isn't it true wearing bandanas over your mouth, nose, and to cover the neck is unsanitary? I'm asking this for my boyfriend because he likes to wear bandanas to protect himself from COVID. Okay, so you're right. The bandanas. Now, the first thing that I'm going to say is that if I don't recommend a bandana at all. We recommend that you wear just a simple, thin surgical mask. That's the best protective measure to wear. And I wish I had one around me. I don't have one right now, or I would show it to you. But I'll post a picture of it. So that's the most common mask that we recommend. I absolutely do not recommend the use of wearing bandanas for several different reasons. Number one, there is not complete fit over the nose and the mouth to allow you that complete protection. That's the main thing. Number two, when you wear bandanas, most people don't necessarily wash them daily, or use bandanas to wipe your forehead if you're sweating, different things like that. It's just not going to allow that snug fit across the nose and the mouth that we know offers you that protection of coverage. So we definitely don't recommend that. And I would recommend, whoever you are, Mr. Boyfriend of Pretty Barbie, that you do wear a surgical mask. They're pretty inexpensive. You can get them at Walmart typically, or pharmacies. They're just kind of some of everywhere. That I definitely recommend that you get the surgical mask instead of the bandana. Okay. So again, we're going to make sure that those 3 considerations again. Okay, hold on. She has another question. She said, I've been trying to tell my boyfriend, and folks are going to be thinking he's a gang member. Right. Oh, she said about the bandana. Well, hopefully they won't think that he's a gang member, but he definitely needs to replace that and get the surgical mask. That bandana is not offering you any protection. The Delta variant will laugh at that. Please do not use that. Use the surgical mask. That's what's going to offer you protection. If you're unvaccinated, the CDC has lifted their guidelines in terms of saying that you do not have to wear a mask, except obviously for public transportation, other things of that nature. I encourage you, especially if you're in that vulnerable population, most especially if you have diabetes, high blood pressure, high cholesterol, heart disease, history of stroke, history of respiratory illness, asthma, COPD, chronic bronchitis, heart failure, AFib, kidney disease, any autoimmune diseases, ulcerative colitis, any of those things, you want to be especially vigilant. And I would give it a second thought before I would say, I'm just going to toss the mask. I might not do that. I definitely, I went in Walmart today, and most of the people in Walmart didn't have on a mask, but I definitely did. And definitely in places, y'all, that we know, there are unfortunately, a lot of sick people come either way because of the place that it is: grocery stores, pharmacies, Walmart, Target. This year for 4th of July, and we'll do something later in the week about 4th of July. In fact, we are doing something on CBS 42 News about 4th of July tomorrow. So join us for that. But you want to make sure that you really, really, really strongly consider, especially with our older population, those are the ones we want to protect the most, going around them if you're not vaccinated. Please give that a second thought. And if you're able to be selfless and not go because you don't want to put them at risk, then you are a hero. And if you are going to go, just make sure that we're washing hands 6 feet away, wearing a mask completely over the nose and the mouth, and that you're not hugging on or being around that person if you're not vaccinated. She said, yeah, Dr. Celeste, I always wear the surgical mask and dressing mask. Yes, dressing masks are cute. And I don't have my pink mask to even show you. There's a cute little pink KN95 mask I got off of Amazon. Okay, so she said, Dr. Celeste, he always walks around with that bandana hanging around his neck when he is just around the family and pull it down. Okay, you know what? So you actually did do this. Hold on, let me find something really quick. Okay, so I want to show this to you guys because you brought up a good point, Pretty Barbie. So when I have been out socially and or with friends, what have you, sometimes we will see people do this. Now, y'all, I'm going to use a mask that is not the appropriate kind of mask that I want you to wear right now, because these were the masks at the beginning stages of COVID that we didn't know, hey, wouldn't be the best form of protection, but it's definitely better than nothing. But if you wear a mask, right, and let's say you have it here, we don't want you to do this. Don't do this. Do not do this. Don't do this. Because you have to remember, when you have it here, as you're going in different places and, droplets, it's going to catch everything. It's going to catch everything so it doesn't get in your nose and your mouth, right? So when you sit with this on your chin, you're sitting with bacteria, virus, whatever here that can get wherever it gets, and you're touching it, and just don't do that. Take it off, put it on a paper towel, napkin if you're out dining while you eat. Put it in a place where you just want to not hold it up, and it has dirt on it, just not healthy, not sanitary. Okay, you definitely don't want to do that. Hi, Miss Jones. July 4th, my wedding anniversary. I want to enjoy and be safe. Happy anniversary. Happy anniversary. Okay, Miss Jones, she's saying she wants to enjoy and be safe. I'm not sure if you're traveling or not, but just travel safely. A lot of people have traveled safely. I have traveled safely. Have yet to do airline flight yet, but I found the cutest thing that I'm going to post later that I encourage everyone to consider, like a little airline packet before you go, that includes all the stuff that I normally just put in my purse in terms of gloves, cleaning supplies, things of that nature if you're going to fly. If you are going to, let's say you're going to a hotel, I encourage you, one of the things that I do when I go to a hotel, I take my Clorox wipes, my bottle of Lysol, and I literally wipe off the knobs of the door. I spray Lysol all over, especially and definitely in the bed. If you have allergies, you might not want to do that. Consult your physician first, whether or not you do that. But I spray Lysol throughout, the room before I take my mask off. And then I'll wipe down, like all the things that people, have potentially touched, things of that nature. That's how I do hotels. Flying, I haven't gotten to that one yet. But I can imagine if I did, I would take all those same things. And then I would just make sure on the flight that I wore an N95 mask. It would come completely here. And, you have to judge it depending on your flight. If it's a short enough flight where you don't have to eat or drink anything, I personally would not do that. because I have to take my mask off and breathe the same air that the other people are breathing. Prefer not to do that. Taking a long flight like overseas, that's kind of not possible. So you may have to just kind of take it down, just for a second, drink, eat, and then immediately put it back on. Make sure you're taking plenty of things to like clean your hands. I'll just clean that seat so good. Even if they said they cleaned it, I probably clean it again myself. Everyone doesn't have the same level of cleanliness. And I hate to say that, but I'm also very OCD. So I'm the one that definitely would overclean, and I definitely overclean when I go to the gym, which I am back in the gym and working out with other people. I've been in the gym, but just not really. My husband and I would really kind of go on our own and go at times when there weren't really one other person there, a couple other people there. But now we're back. We actually did a great team workout this weekend. That was a lot of fun. But I'm still, fanatically cleaning things. So we all know the things that kind of try and help keep us healthy. Miss Jones, for you, I would make sure also that I was really loaded up on my supplements. I'm sure if you're not taking a multivitamin, make sure you're taking a multivitamin, vitamin D, vitamin C, and zinc if needed. She said she really does that with your mask. Oh, yeah, Miss Jones, don't do that. Don't wear it on your chin. No chin wearing mask. It's not a large... just don't do it. It's just not worth the risk. It's just not worth it. So thanks for training about the bandanas. I knew they're insanitary. I had to confirm it with you just to double check on it. Now I'm going to let my boyfriend know so he can stop wearing that. Okay, very good, very good. Okay, so guys, just to remember those 3 considerations, we want to make sure that that those people unvaccinated, 3 reasons to consider vaccination in lieu of the Delta strain continuing to propagate throughout the country. Number 1 is that it has multiple mutations that appear to give it advantage over the other strains in terms of transmission. Number 2, numerous physicians across the world, not the United States, but across the world, are suspecting that the Delta variant may be the most dominant strain in the world and that it will drive outbreaks in the unvaccinated communities and population. And number 3, the reason to get it sooner is it takes 5 weeks to be fully vaccinated if you get Pfizer or Moderna, and 3 weeks for J&J for Johnson & Johnson. Okay, that's all we had to share. Hey, Renette, how are you? So that's all we had to share today. I hope this was helpful. I hope everyone has a happy Sunday. Again, please join us tomorrow morning at 6:30 a.m. on CBS 42 for House Calls. We will be talking about the 4th of July and giving you some tips on how to stay healthy there. So join us tomorrow at 6:30 a.m. for that. If you are in need of a COVID-19 vaccine, we have the Pfizer vaccine. And you can get that vaccine at our office anytime between 8:30 and 3, Monday through Friday. Our office number is 205-291-8842. In addition to that, we're offering COVID testing. If anyone is in need of COVID testing, we offer both a rapid test as well as a standard PCR. It takes 24 hours for that to come back. And then lastly, so excited about this opportunity that we have to serve the community. We will be helping out. There's an event that's sponsored each year with the County Commission. And this year's event is being sponsored by Commissioner Sheila Tyson. And we are partnering with them to bring you vaccines to the Titusville Reunion Day, which is a week from today. It's on July the 4th. So we'll be giving vaccines on 4th of July. Yes. And we will have Pfizer as well as a Johnson & Johnson. And that will be at Memorial Park. So if you are someone, I've had some people say, hey, I couldn't get the vaccine. I work. I can't get off of work. If you are having issues with work and getting off and being able to do it, definitely come out. If you get the COVID-19 vaccine on that Sunday, and let's say you're like, I have to work during the week. I cannot come to get my second shot on that particular during the week. We'll work something out to make sure that we provide you with an appointment on the weekend to be able to do that. So if you know of anyone that is unvaccinated, has not been able to get vaccinated, either because they had hesitancy, they haven't made up their mind until now, and or they have questions, we will be answering any questions that you have about it. But we'll be offering the Pfizer vaccine as well as the Johnson & Johnson vaccine at at this reunion. Okay. And so they're going to have live music there and food trucks. Logan, the entertainer, is going to be there. And they'll have food trucks, music, all of that jazz. We'll be doing the vaccines from 2 until 5, and also giving away free masks if anyone wants one. So that's all we have today. I know that that was a lot. Hope this was helpful. Please share this information with people you love and care about, and people you think that would find it helpful. I hope everyone is doing well. I hope you have a happy Sunday, and go love on someone today. Okay? Have a good day. Bye-bye.